Well, here in Hong Kong, the government has confirmed 2 more cases of the Wuhan coronavirus, bringing the total number to 8. One of them is now in serious condition. That's on top of another 69 new suspected cases. As Jackie Lin reports, medical experts are warning the outbreak in Wuhan could spiral into a global pandemic.
This particular epidemic may be about to become a global epidemic. It remains incumbent upon us to prepare for that possibility, because that possibility is not trivial.
These ominous words are from Gabriel Leung, a medical expert at the University of Hong Kong who is also serving on the government's advisory panel on the Wuhan pneumonia outbreak. Confirming the virus is transmissible between humans and patients could present no symptoms at all, he believes there could be more cases of the new coronavirus than official figures suggest. In Wuhan alone, his team estimates more than 44,000 cases currently, including those in the incubating stage. He says the novel coronavirus is more virulent than the SARS virus, which saw around 8,000 infections globally. His team expects the epidemic to peak sometime in April or May and urges health authorities to look into substantial and draconian measures to limit population mobility as soon as possible. All 8 confirmed patients with the novel coronavirus in Hong Kong are imported cases. The hospital authority says all 8 are in isolation at Princess Margaret Hospital's Infectious Disease Center. Among them, a 56-year-old man saw deteriorated conditions and is now placed in the intensive care unit. 28 people who had been in close contact with the confirmed cases have been placed in quarantine camps. When asked about the cases where the people involved attempted to conceal their travel history, the hospital authority admits such cases could pose extra risk to medical staff, and they will handle the situation with care. The administration decided late last night to bar all those who visited Hubei from entering Hong Kong. Secretary for Food and Health Sophia Chen admitted the ban might not be 100% effective and called for honest declarations of health and travel history among travelers. While a false declaration is punishable by a jail sentence and a fine, this man says people could still lie to evade inconvenience during border clearance. For the growing cost for a shutdown of border crossings, she says the administration needs to weigh the practicality of such a move. Jackie Lin, TVB News.
Well, pressure is mounting on the government to close the border with the mainland to curb the spread of the coronavirus to the SAR. Members of the Labour Party and the League of Social Democrats marched from Central to Government House this morning, calling for an immediate shutdown of all border crossings between Hong Kong and the mainland. They also handed over a petition letter with more than 20,000 signatures opposing a proposed pay rise for police officers. Dozens of pan-democratic district councillors also took to the street as the end of the Lunar New Year holiday approaches. They urge the government to ban all mainland visitors from entering Hong Kong to prevent more imported cases of coronavirus infection. A similar appeal was made by Democratic Party lawmaker Helena Wong.
They will only screen out all those people from Hubei. But the point is that this pneumonia has spread to many provinces all over China except Tibet. What is needed now for Hong Kong is to close the border and use our resources, the medical resources, more effectively to save Hong Kong people.